Today on Clubhouse Gas, Dr. David Marshall of Children's Healthcare of Atlanta is here to talk with us about Little League elbow, what it is, how it affects your child, how you can prevent it, and the treatments available. It's a great show, so stay tuned to Clubhouse Gas. Today on Clubhouse Gas, we're lucky enough to be joined by friend of the show, Dr. David Marshall. Dr. Marshall is the Director of Sports Medicine here at Children's Healthcare of Atlanta. Dr. Marshall, thank you so much for joining us.
My pleasure.
I want to talk today about a study that you did involving elbow-related injuries in Little League pitchers. Now, when a kid gets an elbow injury, a Little League kid, we all know that to be tendonitis, correct?
Not always. The younger kids typically don't get tendonitis. The younger kids, we'll say 14 and below, most often have injuries to their growth plates rather than the tendon.
And that's our target audience, is the 14 and under.
Correct.
And other physicians we've talked a lot about the growth plate issue. Explain to me what the difference in the age and those two injuries is.
Well, the age group, the growth plates, kids have growth plates all over their body. And there's one type of a growth plate called an epiphysis, and that growth plate is found at the ends of all the long bones, and that's a cartilage bar whose job it is to lay down layer after layer after layer of new bone, and that allows our long bones to grow in length. There's another growth plate, which is typically involved in sports injuries, called an apophysis. An apophysis is still made of cartilage, but it doesn't contribute to getting longer. The bones don't get longer at the apophysis. These apophyses serve as an anchor point for muscles and tendon units. Very similar to how a cable attaches to a screw that screws into a plaster wall. If that cable is very powerful, which represents the muscle and the tendon, but that plaster is still cartilage and you keep tugging on it, the screw is going to pull out of the wall. And that's what happens with the growth plate injuries, especially the elbow in youth baseball players.
So as they get older, the growth plate just goes away or grows in?
The growth plate goes through a process called ossification, where the cartilage will turn to bone. It's just like your plaster wall turning into cement. Now the anchor point is no longer the weak spot. Now the weak spot becomes the muscle or the tendon. So the older kids, the high schoolers, the college kids, and of course the pros, they develop tendonitis because their growth plates are no longer cartilage. They've turned to bone.
So the younger kids are having a growth plate problem because that's the weakest point. The older kids are having the tendon problem or the muscle problem because that's the weakest
correct.
point. Is that growth plate problem coming from overuse or incorrect use?
Both. Overuse injuries basically is too much too soon. Too much throwing, too many pitches, too much hitting, too much running. Any tissue, whether it's a muscle, a tendon, a cartilage growth plate, or a bone, has a threshold of failure. You can have the most perfect technique known, but there's always going to be some threshold where that tissue fails and then becomes injured. So the kids that have poor technique, that might drop their arm, that might open up too soon, or they throw all arm, then those kids are going to have an injury resulting a lot sooner than the kid with better technique.
So how do you know that it's not just regular soreness in an arm, or it's just not a kid who's worked out and he's a little sore, but it's actually a problem? How do you know?
Yeah, that's a tough one. And when I talk to coaches and I give lectures to Little League baseball programs, I tell them it is never normal for a young athlete to have pain at the elbow, the shoulder, or anywhere else. I tell them pain is your body's way of saying there's something wrong. That means a tissue down there is starting to fail. Now, there are some kids that have a very low pain threshold, that they may step on a rock or they may bump their arm and they're in pain, where you got these other kids that might have a much higher level of pain tolerance, so their injury is going to go on longer and longer before somebody knows about it. Sometimes kids won't see the doctor, they won't get evaluated because they have pain, but they'll get evaluated when it starts to affect performance. They no longer have that zip on the fastball. They start to lose control, and they're not able to strike as anybody out. That's when the parent says, hey, there's something wrong. Does your elbow hurt? Yeah, it's been hurting for 3 to 4 weeks. Well, let's go see somebody. And I think it's that type of scenario that we're trying to avoid through educating these coaches, the parents, and of course the kids.
And is that like any other injury? If you catch it early enough, it's easier to treat?
Usually it is. If now a fracture, well, those unavoidable single event, broken bone, ruptured tendon, concussions, you can't prevent those, and those kind of fall out of the context of overuse or too much too soon. Overuse injuries are preventable.
So how do you treat the growth plate injury in an arm?
Well, when a kid starts complaining of elbow pain and they say, yes, it hurts over here by the inner part of my elbow when I throw, to me, if they're under 14, that's a growth plate injury till proven otherwise. And I think any young athlete with elbow pain needs to be evaluated. And the first thing you do is a good physical exam. If they hurt over the growth plate, then definitely you x-ray it. And you can see specific changes on their x-ray in the growth plate.
And is that a treatable condition with therapy and ice, or is that something that you have to operate? I mean, how do you get better from a growth plate injury?
Hopefully you don't have to operate it. It all depends on how far that growth plate separates. If that growth plate pulls apart, yeah, there's different parameters, but I use 9 millimeters, which isn't very far. If it separates 9 millimeters from the main bone, then that's an indication for surgical referral, where the surgeons will have to put a pin in it to get that growth plate to get back to the mother bone. If it's less than that, then we typically treat them with rest and sometimes casting. A sling may help, or we just say you can't throw for a period of 4 to 6 weeks while the glue dries, while that growth plate heals.
When a kid originally injures his growth plate from, let's just say, overuse, it doesn't automatically move the 9 millimeters. Does it get bigger over time?
It certainly can. Most of the time, the growth plate injuries are just irritations of that growth plate that they haven't separated. If it separates, we call that an avulsion. If it's just irritated, meaning the x-rays are normal, but they still have pain over that attachment site, we call that apophysitis, or an inflammation of that growth plate.
So if you catch it early enough, you can maybe keep it from getting to that point where you have to have surgery.
Grade 1 injuries can become grade 2s, grade 2s can become grade 3s, and grade 3s can become grade 4s if not taken care of.
So first and foremost, good form. Don't throw too much. Try to stay away from overuse. And if you do have an injury, get it to a doctor as quick as possible.
Let somebody know right away if your elbow or your shoulder starts hurting.
All right, Dr. Marshall, thank you so much. We really appreciate it.
My pleasure.
That's going to do it for us today. We really appreciate you joining us. And we'll see you right back here tomorrow for another great edition of Clubhouse Gas.